Good evening to one and all gathered here. Respected Principal Madam, Dr. Muthuvenkatachalam, Dr. Raki Mishra, co-organizing secretary for this work, online course, and the students and all the participants. We welcome you all for today's session on framing objectives. And we have come to the end of this course, and the last session is also going to be very interesting. And we have our great guest faculty with us, and I request Dr. Smriti Arora, Principal, College of Nursing, to introduce the speaker. Over to Madam.
Good evening, everybody. So today we are pleased to welcome Dr. Muthuvenkatachalam Srinivasan. Sir is currently working as Assistant Professor at Department of Psychiatric Nursing, Institute of Human Behavior and Allied Sciences. He had done his education from AIIMS New Delhi, Psychiatry Nursing, and PhD from Consortium. And Sir is very famous among the nursing students because of his popular book, Target High. And Sir has a lot of publications to his credit, and he has participated in many national and international conferences.
It's fine.
No, let us show that.
I think it's okay.
Just now it was okay. Now some blank screen is coming here, so I'm not able to read.
I hope I will be able to share my slides.
It's not coming.
Yeah,
Ma'am,
leave
you're
it like that.
right.
Yeah. So Sir has won many awards and honors like Sarla Kapoor Award for Best Research Paper in ISBN Conference 2016. And he has received International Travel Grant from ICMR for 4th International Conference on Workplace Violence at Florida. And he received full sponsorship for 6th International Conference on Workplace Violence in the health sector. He is pursuing a FAMO fellowship from Manipal Institute of Mahe and Manipal University. And he has several publications, as I mentioned earlier, 4 textbooks, 14 original articles, and 4 review articles. And his interests are in aggression management, elder abuse, and associated psychological determinants and substance abuse. We welcome you, sir, for the last session. Thank you so much.
Thank you, madam, for your kind introduction. Please, stop sharing your slides while we. My slides are visible?
Yes.
One second. Yeah. So, a very good afternoon, everyone. And I think we are holding you on the Saturday afternoon, but still, I think it will. We will justify why you have, we engaged you in the Saturday afternoon today. What I'm going to discuss today in the next 1 hour or so is framing educational objectives and Bloom's taxonomy. These both are interconnected because the Bloom's taxonomy is nothing but a framework which serves as a framework for framing educational objectives. So, and before moving to that, I just thank AIIMS Rishikesh and the principal cum professor, Dr. Smriti Arora madam, for initiating this online course so that people from different part of the country can get benefit of learning from expert of the field, as well as they have the chance to engage and discuss with all the senior people. And also I thank for inviting me to this endeavor so that I can contribute to my part too. Thank you. Is slides moving?
Yes.
Yeah. So since the class is all about learning objectives, I don't want to skip to the first slide as I always do. I just start with the learning objectives as we do in undergraduate classroom. At the end of this session, the participants will be able to define the term educational objectives and explain the purpose in education. Describe the concept of educational objectives and their importance. Identify the different types of educational objectives, including cognitive, affective, and psychomotor objectives, and explain how they relate to different domains of learning. Describe Bloom's taxonomy and its 6 levels of cognitive learning. Apply Bloom's taxonomy to create learning objective for a specific lesson or activity. At the end of the session, almost at the end, I will again discuss whether showing the complete objective in a structured manner is necessary, or it is, is it advisable, or is it right? We will discuss like a debate at the end. So right now, just for the sake of presentation, I have presented all the objectives clearly. First of all, to start with, someone can please confirm, is there any noise behind my voice? Or is it clear?
It is clear, sir.
Because there is some motor work going on outside, I can get a lot of noise around, but I'm sure I want to make sure
No,
that...
sir. It is not coming. It is not disturbing. Carry on.
Thanks to my mic. Okay. First of all, goals and objectives. So we need to differentiate what is the difference between goals, and as many of you may know already what is goals and objective. Goals is always a broad statement, broad and general statement, and it is non-specific. And it is a broad statement of what you want to achieve at the end. They provide direction and a sense of purpose, but they don't offer much detail on how to get there. For example, the institute may state that we need to achieve 90% admission or 90% pass out from the graduates, or you may state to improve the quality of nursing education in the institute. It may be a broad goal, but how to achieve that broad goal? Then comes an objective. Objective is nothing but a specific, measurable, and a time-bound statement. It should be specific. What exactly you want the learner to achieve at the end of the course, and it should be measurable. So you have to be very careful that it should be stated in a way that it can be measured. Often it is stated in an objective that a student understands. How do you understand what students understand? How do you measure that? And student student knows. So these are all not right statement. So whatever the acts and verb you state, that should be measurable. But like student performs, you can measure. Student defines, you can measure. Student enlist the signs and symptoms of diabetes mellitus, you can definitely measure it. So you have to be careful that when you state objective, it should be measurable. We'll discuss more into that. In the beginning itself, I just want to make sure that specific, measurable, and time-bound statement that support the achievement of goals. So goals actually give it's a broad statement, but that gives some direction to make objectives. They break down the goal into smaller, more manageable pieces and provide a clear roadmap for achieving it. Comes to educational objective. First of all, what is educational objective? To define, educational objectives are statements of those desired changes in behavior of learners as a result of specific teaching learning activity. For example, in this teaching activity, at the end, as a participant, what are you going to, what are the desired changes I expect from you? That is to be stated. That is what called educational objectives. Framing educational objectives is an essential step in designing effective learning experience. So if you frame an educational objective, that inform or that directs you to design effective learning experience. So the entire learning experience is designed or structured based on what is your educational objective. So the educational objectives must be very, very clear to make a correct, to develop or design the effective learning experience. Next is clear and measurable objectives provide a roadmap for educators. It provides a guidance, or you can call it as a roadmap for educators, trainers, and instructional designers to create a relevant content that aligns with desired outcomes. So if there is a clear and measurable objective, that helps the educators or the teachers or trainer, whatever you call, help them to create a relevant content that aligns or that is congruent with the desired outcome. What the outcome you wanted from the student, the content should be matching. How it can be, how it can be matched. First of all, you need to have a clear objective. So that road objective is actually paving a way to design your content that meets that meets the criteria to achieve the desired outcomes. Finally, by defining educational objective, learners are also given a clear understanding. Learners are also given a clear understanding about what they will be able to accomplish after completing. So in the beginning itself, learners are very clear what they are going to achieve at the end. So they'll be focused more. And the educational objectives provide a clear, what I have discussed in the previous slides, I just to summarize that. Educational objectives provide a clear direction and purpose for learning and serve as a framework for designing, implementing, and evaluating educational programs. So these are kind of an interaction. First of all, you set a curriculum, then you have a pedagogy, that like what are the strategy, what is your teaching learning activity, all those things included in the pedagogy. Then assessment, how are you going to assess at the end? How are you going to assess whether the desired behavior, desired changes in behavior has occurred in the student or not? It is, we always bother about the product. Okay, the product, whether the product has come as we decide or not, has to be assessed. So this serves, these educational objectives serves as a framework for curriculum development, setting the pedagogy, the learning instruction, all those structures, then also setting the assessment criteria and within the learning environment. This is how it goes. First of all, you frame an objective, then that gives rise or that guides you to create a content, and that guides you to develop the activities, teaching learning activities. Then you design how it is going to be assessed. That means what behavior changes has occurred in the student, how it is going to be assessed. So this works like a chain. Objective, then design a content, and then you plan for teaching learning activities, then you plan, you develop or design your assessment plan beforehand to measure it. So while writing objectives for educational programs or any instruction, the focus is on the student's performance, not on teacher's performance. Often, when I see some of the lesson plans brought by students, when they first time when they start writing the lesson plan, when they are stating their objective, rather than writing what students are, instead of, often the objective are written in a way that students are able to, at the end of the session or at the end of the lecture, students are able to define diabetes mellitus, describe pathophysiology, enlist the signs and symptoms. This is how you write. That is what students expect to do at the end. But rather they will write objectives in a, that is also one type of objectives, that is called teacher centric objective, that will tell what teacher will do in each of the steps. Often when you write a lesson plan, you bother about what teachers, you are focused on what teacher going to do, as you are a training teacher. So most of the time they write focusing on that, what teacher will do, okay, to explain these, to inform these, to explain, to demonstrate, like that. So it's not that way. The focus is always on students' performance. What students will perform at the end is the focus, not the teachers. Then the focus is on the product, not the process. So the objectives clearly states what is the end product. The process will be designed to achieve that. That is a different thing, but it is not part of writing objective. Writing objective is always focusing on the end product. At the end of this session, demonstration session, students will be able to demonstrate the medication administration using intramuscular via intramuscular injection on a simulated patient, or in mannequin. This is what your objective should state. But how you will teach, how students will learn that, all those things not part of objective writing. Based on objective, you will develop the pedagogy, you will develop the instructional strategies, what is the method you will follow. All those things will be, this will serve as a framework, as I discussed before. But actually the focus of writing objectives on the products. The focus is on the terminal behavior. Again, kind of a little bit of repetition. The focus is on the terminal behavior, not the subject matter. What? Not the subject matter, but the terminal behavior at the end. What is the behavior, the changes that has occurred in the subject, or subject in the sense the student or participant. So why to use educational objective? According to Groundland in 2000, it is to provide a focus for instruction, to guide instructional planning instruction, to provide guidelines for learning. This is usually for the students. So how it will give them some guidance what is being learned. So provide guidelines for learning, to provide targets for assessment. So what is to be assessed? What are the variables to be measured? What are the behavioral change or at the end product which is to be measured? To provide a target for that assessment, to communicate expectations to learners. So the learners are informed what is expected from them by the teachers. Okay, so it is the method to communicate the expectation to the learners. So the learners are well aware that what is expected from them at the end of the session or end of the course or program, whatever it is. To convey instructional intent to others. So to convey intent to others, then to provide evaluation of instruction, to also provide the framework for evaluation or assessment at the end of the instruction. So there are types of objectives. One is institutional, intermediate, and instructional. There are other type also, like teacher centered, behavioral centered, and student centered. All those there are different classification, but what I would like to focus here is that it is kind of broad. The institutional objectives, then comes intermediate objectives, then comes instructional object. These three are well connected because intermediate address the institutional objectives, then instructional objectives address the intermediate objectives. So I briefly discuss about all these three types before going to see how to develop objectives or how to frame objectives. Under institutional objectives, these are broad long-term goals. The moment I say broad goals comes, okay, it's usually a broad long, it does not specify a very short term. Usually it's a long-term goal that are set by an organization or institution or educational system. They are often related to the overall mission of the organization. It is something like mission statement. You might have heard this mission statement of the institute, all those things, because they have a long-term goal. Okay, that is often known as institutional objective. For example, increase the number of nursing graduates by 20% within the next 5 years, or achieve a 90% pass rate in the university examination among nursing graduates. These are kind of institutional objective. You see, it does not say how it can be achieved. It is just an institutional objective which is very broad. Then you will come up with the intermediate objective that will address and break down this institutional objective. And then again, those objectives, again these intermediate objectives again broken down, and you make a instruction strategies to, while planning the course or while planning any programs. So the intermediate objectives are goals that are set to support the achievement of institutional objectives. They are typically more specific and measurable than institutional. I said institutional objectives very, very broad, and this is less broad. I mean, this is a little bit specific, not as specific as instructional objective, but it is more specific and measurable than institutional objectives. Focus on outcomes such as student achievement, program completion rates, or employment rates of graduates. Not very specific, but little bit specific than the other one. It, for example, increase the number of nursing students who complete their program by 5% within next academic year. By next academic year, reduce 5% of attrition or increase 5% of completion rate of nursing. So that's what the meaning. or increase the number of nursing graduates who are employed in the healthcare field within 6 months of graduation by 10%. At least make sure that 10%, at least the nursing graduates must be employed within 6 months of completion. That should be increased by at least 10% in the next year. That's what the intermediate objectives. So whereas the institutional objective said about the 5-year goal, it starts about 1-year goal and little more specific. Then comes to instructional objective. These are specific, measurable, and observable learning objectives, learning outcomes that are designed to support the achievement of intermediate objectives. As I said told you before, it is 3 are connected. First of all, institution, then intermediate, then instructional objective. This actually designed to support achievement of intermediate objectives. They describe the knowledge, skills, and abilities, including affective domain, that students are expected to gain as a result of a particular lesson, course, or training program. That's what we were talking about all the way. For example, students will be able to identify the signs and symptoms of heart failure in a patient and develop a plan of care to manage the condition. Or another example, maybe students will be able to demonstrate administration of medication via intramuscular injection. This can be an example of instructional objective. This is student-centered or learner-centered. What are the key factors that is to be considered while you are framing objectives? First of all, identify. Know your audience. Identify the target audience to whom the program is, so to whom the objective is framed. If whether the objective is framed for a nursing student or a paramedical student or a physiotherapy students or a nursing faculties, or you are planning for kind of an intermediate level, postgraduate students or undergraduate students. So know your target audience before framing your objective. Then define specific and measurable learning outcome for that target audience. Then establish a timeline for achieving these outcomes. So when you want to achieve these outcomes, so that clearly state the timeline also. Then select appropriate assessment methods to evaluate learner progress. Whenever you develop or frame objective, you should always select or keep it in mind that you should clearly select the assessment method. For example, there may be a formative assessment, there may be summative assessment, there may be essay type or MCQ objective type, or several method of presentation, or many types of presentation there. I think you had a session yesterday on this, yesterday or day before, in couple of days, I think. So you have to choose what is the assessment method you are going to have for measuring the outcome. It is important to align educational objectives with broader institutional or organizational goals to ensure that learning outcomes contribute to the overall mission and vision. So always the institution have a vision and mission. That's what institutional objectives. So your educational objective, learner-centered educational objective or learning objective should address address or should be focusing on achieving the overall mission and vision of the institute. Coming to the actual main part, that is writing objectives. So usually always it starts with a STEM. So very simple. All of you know it's very standard that the learner, the participant or the students, you can state whatever is comfortable. The students will be able to the students will, at the end of the session, the students will be able to, then you will put down list of objective or goals or objective which is to be performed by the students at the end of the session or sometime at the end of the course. Here I am saying at the end of the session because I am focusing on only my session. But if you ask Dr. Smriti madam, who designed the course, and Dr. Belsi, they will have an objective for this entire course that will have several other broad general objectives and many special objectives. For me it is different. For this session there is a different objective. So start with the STEM, and next is use Bloom's taxonomy because Bloom's taxonomy have different levels, different domains, which we are going to discuss in next 10-20 minutes about Bloom's taxonomy, about all these domains, and make it measurable and meaningful. Always when you make objective, make it measurable and meaningful. I will be telling how to make it measurable and meaningful at the end, and include the performance. These are the three major. One more component also often people include, that is content, but major component is the performance. Performance always include content also. So the performance, criteria, and condition. So these are the three major components in the objective. You have to make sure that is there. So we'll see one by one. First, let us move on to the Bloom's taxonomy. So first to move on to the STEM, then to Bloom's taxonomy. STEM is very simple. I already told you, by end of this session, or by end of the course, or the end of the short term course, or end of the program, whatever it is, students will be able to. That is going to be the standard STEM. And after that, you will list down those achievements which is expected from the student. That is, describe the steps of framing learning objectives, draft learning objectives for the given topic. So this is how the STEM and also it followed. But I'm just focus on this part, that is making the STEM. I'll come to this part later. How will you fulfill these components? So we'll move on to the second component. You have to incorporate, as I already told you, Bloom's taxonomy serves as a framework for framing. It serves a framework for drafting the learning objectives. So we need to learn taxonomy. I'll probably send next 10 to 15 minutes on Bloom's taxonomy. So Bloom's taxonomy is commonly used framework for developing educational objectives. Bloom's taxonomy attempts to classify learning stages from remembering facts to creating new ideas based on the acquired knowledge. The idea of Bloom's taxonomy is that learning is a consecutive process. The Bloom's taxonomy describes that the learning is a consecutive process, and it says that before applying a concept in real life, we must understand it. So whenever you apply a concept, you need to understand that concept. Without understanding, you cannot apply. And similarly, before understanding, you should know it. I mean, in other terms, you should be able to recall it. If you don't have any recall capacity, you will not be able to understand. So first of all, memory or recall or remember, then only you'll be able to understand, because for understanding, you need to recall memories. You need to recall your experiences. Even experience build your knowledge. Then that is stored. Then you need to recall those experiences to understand. Then you need to understand to apply that. First of all, you understand to apply that. Then go and so on. I will be discussing about it. But why use Bloom's taxonomy to frame objectives? Objectives are learning goals, in other term, vernacular language, you say, in layman's term, are important to establish a pedagogical interchange so that teachers and students alike understand the purpose of that interchange. So students as well as teachers understand what is the pedagogical and interchange going to happen in the learning experience. Next is organizing objectives helps to clarify objectives for themselves and for students. So one who organize or one who frame objective, first of all, they understand, and it helps students to understand. Then having an organized set of objectives helps teachers to plan and deliver appropriate instruction, design valid assessment tasks and strategies, and ensure that instruction and assessment are aligned with the objective. This I have already spoken about it, but little bit about it, that ensure that instruction and assessment are aligned with the objectives, because only if you develop objective, then only you are able to plan your instruction and assessment, and both has to be aligned or in congruence. Sorry. Little bit about the original Bloom's taxonomy, which was published first described in 1956 in the textbook Taxonomy of Educational Objective by American educational psychologist Benjamin Bloom. and his co-authors Max Egelhart, Edward First, Walter Hill, and David Krathwohl. Their book classified the learning goals into 6 components, 6 levels, in fact, in a hierarchical manner. But later, the pyramid was developed much later. What the pyramid which you are seeing in the Bloom's Bloom's taxonomy was not initially described. It was later developed and given a pyramid shape, because one after other it was forming a hierarchy. First of all, knowledge, then comprehension, application, analysis, synthesis, and evaluation. It's important to note here all these, all these all these tiers, we call it tier because it's put in the hierarchy, have, nouns, not the verb. Later in 2001, I'm going to discuss about the revised Bloom's taxonomy. This all has been revised into knowledge become, remember, then, understand, comprehension become understand, application become apply, analysis become analyze, synthesis, evaluation become evaluate, and it was, flip. I'll be discussing about in the next slide. Then comes the revised Bloom's taxonomy. Later I will discuss about what I was talking about, how the nouns become verb, why it has become. To provide learners with clear instructional goals, a group of researchers led by Bloom's colleague David Krathwohl, which I have discussed in the previous slide, and one of Bloom's student Lauren Anderson, revised the taxonomy in 2001, which we are actually following. In the new variant, nouns were replaced by action verbs like applying become apply, understand, I just show you. Synthesis becomes synthesize or create. It has been changed to create. Evaluation become evaluate. Okay, so that's how it all these nouns has been changed into verbs. Also, the 2 highest levels of taxonomy were swapped, because earlier the highest level was evaluation, before that synthesis, but later the highest level becomes synthesis. In other term, synthesis become a create. That is the highest level because it requires creativity. That is highest level of, that is a, always creator is on the highest level of hierarchy, because it requires their own thinking and own output. After understanding all those things, after understanding, after applying, after evaluating, they have to create their own. That's why that is highest level. So this has been swapped. The authors also defined cognitive processes associated with these instructional goals. For example, the ability to remember requires recognizing and recalling. You can state a remember is a verb, but that requires recognizing and recalling. Remembers includes, you have to recognize it, you have to recall it. You have a lot of storage, you have a lot of experience storage in your brain, but to remember, you have to retrieve from that information. If it is loosely organized, and you will not be able to recall and to remember. Classifying, before move to that, classifying educational objectives with Bloom's taxonomy is, one is cognitive domain. Usually these are mental skills. Next is affective domain. These are beliefs and attitudes. And a psychomotor domain, that is physical skills. We usually say head, heart, and hand. 3H. Head, cognitive domain because mental skills, so we connect to head. Affective domain is all about hearts because it's a belief and attitudes. It comes from the heart, we often say. Then the psychomotor domain, but I don't know exact connection between this attitude or the affective domain with the heart, how it is connected. Heart does not think, only brain thinks, either it is an affect or whether it is a mental skill or the attitude, both brain only responsible, but often we always connect this kind of attitude as well as the affective domain with the heart. It's a popular belief, I don't want to disturb that. Then psychomotor domain, as a domain, there is a physical skill. So here it is the cognitive domain, affective domain, and psychomotor domain. And see, the cognitive domain has been revised in 2001, but the publication by Krathwohl is 2002, so it is mentioned 2002. See, the level is remember, understand, apply, analyze, evaluate and create. Next slide, I will compare the 1956 on 2001 in the next slide. Right now, just see. Remember, understand, apply, analyze, evaluate, and create. All nouns now become verb, action verb. The affective domain have not been changed. So there are some researches going on, but no concrete changes has happened from the initial version. The receiving, responding, valuing, organizing and conceptualizing, characterizing by values, and the psychomotor domain, the tiers are imitation, starting from bottom, imitation, manipulation, precision, articulation, and naturalization. This is how the psychomotor domain, the tier goes up. One second, just excuse me. Sorry, I'm alone at home, so I couldn't. There is no one to open the door. I went for a, calling bell. Thank you. So this is the comparison. The 1956 Bloom's taxonomy says that knowledge, all are nouns: knowledge, comprehension, application, analysis, and synthesis. You see the difference here. Knowledge become, remember, comprehension become, understand, then application, apply, analysis, analyze, the evaluation come to the evaluate, and synthesize moved up. Synthesis nothing but creation. Okay, so but create, it is converted to a verb form, so that it become create, and these two are swapped. These two are swapped from the earlier version. This is more objective. Just let us discuss with a little bit of example about these, and I also will give you some interaction in this slide. First of all, remember, it's the first stage. Okay, in hierarchy we'll put it in this way, pyramid, but I put up, just to describe, I put one by one. First of all, in remember tier, students are asked to recall information without necessarily understanding it deeply. It requires just a memory and recall. Can you frame an objective based on this? Any one of you? You can chart. You can put it in the comment box. Any one of you? Quickly. Remember, students are asked to recall information without necessarily understanding it deeply. Any response? I give you 30 seconds. Any one of you? No active participants? List the signs and symptoms of meningitis. Very good. End list, you can say. List is also fine. Define, list out. Okay, right. Those are action verbs. You are talking about action verbs. Someone written full objective also. Students will be able to recall, but recall is not measurable. No? So that's what I said. A recall can be, you can call it as a remember, but that is not measurable. You cannot, that is not an action verb. You have to use either enlist, define, describe. So like that. Able to recall is not the right way to put. Types of dialysis is fine, but instead of recall, you can say enlist the types of dialysis. So we have got 3 responses. Fine, very good. Let me move on to. So I will show an example. 1 second. List down the antihypertensive drugs. So it is nothing but a recall. If you know about it, and you will be able to recall it. So further, I will ask you to frame objectives, go to the higher level of the same. So we talk about now medication, like antihypertensive drugs. Use the same example. Then let us move on to understand. In the remember stage, we have asked to, okay, I asked to frame one objective. You made it. Few of you made it. Then I made one objective that lists down the antihypertensive drug. Even I can ask define antihypertensive drugs or classify antihypertensive drugs. This also comes into remember only. Then move on to understand. In this stage, students are asked, go to a higher level of thinking. Students are asked to demonstrate comprehension of concept or idea. So let us take a same example of antihypertensive drug. Putting into nursing scenario and antihypertensive drug, can you form one objective which address to understanding? Understand the little bit higher level of thinking. Any one of you? Very good. Someone put a query, but if you have framed it correctly, I would be more happy. How antihypertensive drugs work? Very good question, but frame it as an objective. Yeah, very good. Someone come with to explain the mechanism of action of ACE. I think you mean ACE inhibitors. Very good objective. Because that talks about understanding. You can recall, but you see, you know antihypertensive, but how it works, that means you need to know the drug. You need to know what is ACE inhibitor. You need to know what are the enzymes, what are the physiological phenomena. Then only you'll be able to come to the conclusion how the drugs works. You need to know the pharmacokinetics of the drug. You need to know the pharmacodynamics of the drug. Then only you will be able to answer this question that how antihypertensive drug works. That's very good. Some of you have given a good answer. Students will be able to check blood pressure before administering antihypertensive drug. So that will come little bit of an application. Okay, let us see. Okay, you have gone, I think, one step ahead. Understanding is at I think almost similar to I also explained the mechanism of action and potential side effects of propranolol. It is one of the antihypertensive drug, beta blocker. So students will be able to explain this after knowing all these things. So that comes at the next level. Then let us move on to the apply stage. Students are asked to take what they have learned and applied. So far, they know what is antihypertensive drug. They know the mechanism of action. Now they are asked to apply that knowledge, what they have learned, in a new situation or context. Can you form one objective on this? So that leads to better understanding. I also will ensure you understood. Expecting at least one answer before moving. Okay, administer antihypertensives at same time of day. No, not exactly to the point. Anyone else give a try? I hope all of you trying. I'll wait for another 30 seconds for any good answer. Anyone? How the knowledge and the remember and understand level of knowledge is applied. How the student is able to apply. How will you frame an objective? Identify side effects of ACE inhibitor. Okay, that again. Okay, to some extent, demonstrate vital signs. Not very close. Okay, let me show you how the application can be measured. Identify the appropriate drug, dose, and route of administration, taking into account the patient's age, history of allergy, and medical history. The route was mistyped, typological error. Identify the appropriate drug, dose, and route of administration, taking into account the patient's age, history of allergy, and medical history. So you see, you know the drugs now, you know the mechanism of action, and also you know the side effects based on first two levels. Now you should be able to identify. That is what application of the previous level of knowledge. You should be able to find out appropriate drug based on these information, like patient's age. Patient's age makes, because it depends on age, you have to adjust the dose, because we are told drug as well as dose based on the age, then history of allergy, and also the medical history, whether the patient have any allergic to any drug or any drug interaction or any drug food interaction. All those things to be considered before identifying. That is level of application. So let us move on to the next level. Analyze. In analysis stage, students are asked to break down complex information into its component parts and examine how they relate to one another. Usually analyze, analysis always to break down. Whenever you break down, then only you will get analysis. Whenever you assemble it, you will get create. That's why when you go and join any job, or see, analyzing is easy because you have to break down, but creating is difficult. You have to assemble that. You may have experience when you try to repair your kid's toy at home. You may be easily, whenever you try to repair it, you usually dismantle it, okay, to analyze what is the problem. But when you are asked to assemble it again to the previous same stage, you will struggle, and your child will scold you. I have told you not to open it, you have opened, now I want new thing. That's what often we experience at home. Just want to connect you. So analyze is nothing but breaking down complex information into component parts and examine how they relate to one another. So let us have an example on that part. Compare and contrast vasodilators and beta blockers used to treat hypertension. Now the students will be able to, at this stage, analyze stage, the students will be able to compare and contrast vasodilators and beta blockers. What is the advantage of vasodilators over beta blockers, or what is the advantage of beta blockers over vasodilators used to treat hypertension? So they'll be able to compare and contrast and decide. That's how analyze works. Okay, then comes to evaluate. In the evaluation stage, students are asked to make judgments, because here comes evaluation. Judgments about their quality or value of information or action. For example, assess patient response to a medication. Assess patient response to a medication and determine whether the dose or route of administration needs to be adjusted. This is next level. You see, now you know the drug, you understand the mechanism of action and potential side effects, then you are able to apply this knowledge to decide what is an appropriate drug and dose, route of administration, and you are able to compare what is the pros and cons of two different drugs. So among these, what I will decide. Then finally, how these drugs work, you need to evaluate. You should develop skill to evaluate what is the response to this medication and determine what is the dose and route of administration to be adjusted based on this evaluation. Finally, create, that is the highest level of in this hierarchy of this domain. Then students are asked to use what they have learned to generate new ideas, products, and solutions. So from all these level, whatever you learn from that, you should be able to create that highest level. For example, develop a medication regimen for a patient with a hypertension, taking into account potential drug interactions and a patient's preferences and lifestyle. Here you see, you have to create a separate, create a module for the class. So you have learned all those things. So you have learned different chapters of education. You have graduated, but now you are asked to develop a short-term course based on whatever you have learned, considering the target group, considering the time frame, considering the method of delivery, like online or offline. You are asked to develop a module for a course. That is what called create. So develop a course plan for undergraduate students on so and so subject. That become a create objective. So I have used one single example to take you through different levels of this domain, so that it gets better understanding about the concept. So that's how this level, like remember, understand, apply, analyze, evaluate, and create. And this shows also the action verbs which can be used at different levels. When you are using this remember level, just a recall facts and basic concept, the appropriate action verbs to be used are define, duplicate, list, memorize, repeat, or state. Then next level is understand, that these explain ideas or concept. You have a concept, but you have to explain that, okay, from the recall. So classify, describe, these are kind of an understanding level. You are able to classify, you know all the drugs, you are asked to classify. That means you need clear understanding what drugs come from which chemical components, you are able to classify, or you know that what drug act how, what is the mechanism of action. Then only you are able to classify based on the mechanism of action, based on the chemical component, all those things you are able to classify, or describe, discuss, explain the concept, identify, locate, recognize, report, select, or translate. These comes at understand level. When you use apply, use information in new situation. You know, remember and understand, you are using in a different situation, which you have seen an example in the previous slide. Now, the action verbs to be used here are execute, implement, solve, use, demonstrate, interpret, operate, schedule, sketch. So this is at application level. At analyze level, draw connections among ideas, differentiate, organize, or relate, compare, contrast, distinguish, examine, experiment, question, test. These are action verbs to be used when you are framing objective at this level. At evaluation level, or evaluate to be precise, justify a stand or decision. Whatever decision you have taken, you have to justify. That's what at evaluation level. Apprise, argue, defend, judge, select, support, value, critic, weigh. But you have to be careful that you are not supposed to use any, even action verbs are listed, but avoid action verbs which is not measurable. When you prepare a very good objective, that is to be kept in mind. Next is to create. Produce new or original work. Here, design, develop, assemble, construct, formulate, author or investigate. These are at creation level. These are the some of the action verbs. I don't want to go through each of it briefly. Few I will read. Maybe at knowledge level, list, define, recall, arrange, state. The recall, someone you pointed out, it's right, but not very well, because it is not measurable. Okay, next is comprehension level, translate, paraphrase, discuss, report. In application level, operate, apply, solve, demonstrate, prepare, show, sketch. Like that, we have seen in the previous slide also. It is again more comprehensive list. Okay, you can always have a reference in future, because due to time limit, I move on to the next slide. This is one study conducted very recently, published in 2020. I have shown in the previous slide and the previous slide a lot of action verbs. There are several action verbs, but this interesting study was conducted in UK among 35 universities. The list of action verbs which they use in objective has been collected. These researchers collected the action verb which is used by teachers, framing educational objective in 35 universities in UK, that has been compiled and compared. And they found these are all the action verb which I listed here were most common, and there are consensus in using these verbs. Okay. So that has been listed here, and they also mentioned avoid. Okay, avoid, appreciate, know, familiar, aware, understand, select, explain, relate, arrange, choose. So they suggest these to be avoided when you are framing objective as an action verb. Okay, so these are avoidable, and all others listed in this particular slide are most commonly used among these 35 universities. Let us move on to the affect. I spend a little more time on the cognitive domain. Move on to the affective domain. So we have receiving. Receiving is nothing but these are different steps. Receiving is being aware of or attending to something in the environment. Next level is responding, showing some new behaviors as a result of experience which learned at the previous step. Then at valuing, showing some definite involvement and commitment. So you start valuing that so that you show some definite commitment and involvement in that activity. Next is organization, integrating value which I have learned in the previous step into one's general set of values, giving it some ranking among one's general priorities. So it becomes one's general priority because you have learned to value. Then you set into a general set of value in your general priorities. Then finally, characterization by a value system. Here, acting consistently with the new value. You have value, you have learned a value, and you put into your priorities. But if you are acting consistently with the new value, then person is known by that value. Okay, sometimes we know that, this teacher never accept you if you come by late, but teacher also never comes late. That become the teachers coming in time. It become it's an affective domain, because she know the importance of it, she learned, and she know how to value the time and become punctual. Then it become her general priorities. No matter what, I want to be in time. Okay. Then consistently every day coming in time. So the teacher is known for that value. So that's how it become value. Once value, when they consistently practice that value, then it become their character. That's why we call it, we even often you keep some nicknames also to teachers or sometimes known people based on their character. That character comes from value. When the value become organized, then that become a habit. That means consistent, that become a character of that person. That's what all about affective domain. So the objectives in the affective domain include some of the examples. Ask right questions during history taking. This is often, it's one of the challenging tasks is how measurable the affective domain. It's very difficult to measure the affective domain except few circumstances. It's a challenging task to assess the affective domain. Ask right questions. The student is able to ask right questions during history taking, honoring the dignity of patients. Students will be able to assist patients in carrying out ADL, initiates building IPR with patients, combines various interactive skills to develop IPR, recognize and the ethical issues involved in using people for research, demonstrate the courage to advocate for patients' rights, value the importance of hard work, intensity, and attention to detail, commit to a personal program of lifelong learning and professional development. These are some of the objectives based on affective domain. First, most commonly used are the previous domain. That's why I spent a little more time, more practicable, more measurable, and also a psychomotor domain, particularly in the context of nursing. Psychomotor domain objectives are also very, very important because we are focusing on competency-based program. Skill-based education and competency-based. So the assessment, the objectives based on psychomotor domain is as important as the cognitive domain in nursing. Move on to the psychomotor domain. It have a different level, again, perception, set, guided response, mechanism, complex overt response, adaptation, and origination. This is how it develops. I use one example of like I use the medication example above. Here I am using a driving example because everyone listening to this class knows driving, either it is a scooter or car or whatever it is, at least cycle, whatever it is, driving. So how did you learn driving from the beginning? Then you can clearly understand these levels of psychomotor domain. Initially, everything starts with the perception because you see process of becoming aware of objects, qualities, etc. by way of senses, basic in situation interpretation, action chain leading to motor activity. This is the stage where you sit on the left side and you observe where is the gear knob, where is the instrument cluster, where is the brake. Just observe. You will just visualize and you see your driver. You will be sitting in the co-driver seat. You will be visualizing how is driving. That's how you perceive where is what are the qualities, how this works. That's all. Next is set. On your mark now. Readiness for a particular kind. Okay, you decided to learn now. Readiness for a particular kind of action or experience may be mental, physical, or emotional. First of all, you have to be mentally ready. Physically comes next. First of all, you have to mentally, okay, I am ready to set, ready to go. That's how you start. Okay, that's what first two levels are, like perception and set yourself. Next is it's very, very important. So it's guided response. Overt behavioral act under guidance of an instructor or following model or set criteria. If you have gone to a driving school, you will be first of all sitting in the driver's seat. Left side, there will be another driver having half of the control with him. Steering is with you, but the clutch and brake also have another additional clutch, and this is on the left side. So he makes sure you are under a strict guidance. If you are putting into the patient side also, first of all, you do it in a simulation only, not directly going to the patient because patient may get harmed. So when you are doing in the simulation also, teacher is there to, if you are putting your, and if you are doing intramuscular injection, if you are not able to locate the right position, teacher is right there to catch your, hold your hand and help you to put how do you keep your fingers to measure, then locate the, locate the site where you are going to give injection. That's how this works. Okay. Next is mechanism. A learned response become habitual. Learner has achieved certain confidence and proficiency of. So after the guided response, now the learner have little bit confidence, so become little bit habitual. Where is the brake? Okay, where is the accelerator? When to press accelerator, when to press brake, all those things become little habitual. Muscle memory has developed. Because at the first stage, I'm just giving an example of, a knowledge of driving only again, because that helps you better understanding, because everyone gone through that experience. First of all, you will think, or sometimes you will see down where is the brake and accelerator before pressing. Your foot will not understand where is the brake and accelerator. Instead of seeing the look at the road, you will put down your head and look at the brake and accelerator. That's how your muscle memory has not developed, and you are not become habitual. The moment you become habitual, your foot knows where is your where is your accelerator and brake, and it will find out. You don't need to look down. Otherwise, you will not be able to find out. When you are typing also, if you have learned proper typing, your fingers knows where are the keys, not your eyes. If you did not learn properly, you look at the keyboard and then type, because you will look at the key, then you will connect the finger and keyboard. But I am the learned typewriter, so I don't need to look at the keyboard, because my fingers know like that. My fingers know where are the keys. So that's how they become habitual. Next is complex overt response. So at this stage, performance of motor act considered complex because of movement pattern required. So at this stage, if I apply into car driving, you are able to drive somehow, because you learned, it become habitual. You are able to drive. You are able to drive in a controlled condition. That's all. It become things are complex, but you are able to learn. Next comes adaptation. This is how somewhat critical position, because altering motor activities to meet demands of problematic situation. You know how to drive. If you are asked to drive within the campus, you will drive, because there is no car coming in the opposite. There is no signals. There are no crowd. The moment you are asked to drive in a crowded road or with the traffic, you become nervous, because it requires problematic situation, requires adaptation. You are very confident in an empty road, in a playground, but you are put on a real road with a crowd, you become nervous. Same thing. You are very confident of giving injection in a simulator or in mannequin. But when you are going to a real patient, you have challenge, because patient will scold you if you give two-time pricks. For example, if you are doing a intravenous canalization, you know that if you are pricking more than once, he will get angry. So that is always there is a safety involved, pain involved, patient perception involved. When you are putting into real-time situation, you become nervous. That's what that requires adaptation. I given both example, nursing and driving. Finally, origination. Creating new motor acts or ways of manipulating materials out of skills, abilities, and understandings developed in the psychomotor. Once you have adopted well, even you will be able to achieve what others could not achieve, because you develop your own way, and even that's how people achieve what others not have achieved. For example, driving fast, or driving from this to this place to this place within a very short period of time with the highest accuracy. All those things come in nursing. Also, your skills goes to the next level, that become origination. Even closing your eyes, you will be able to do that procedure correctly, 100% accuracy, with 100% accuracy. So now some objectives on psychomotor domain. The moderator can confirm how long I'll have. Can I take another 10 minutes to complete?
Yes, please.
Yeah, I think the session is till 5:30, right?
Yes, sir.
Yeah, right. Okay. So the objectives on psychomotor domain: perform a basic physical assessment, including taking vital signs and measuring height and weight within 20 minutes. It is a time-bound, objective. See, within 20 minutes, the person should be able to complete taking vital signs and measuring height and weight. So, for example, for doing the same task, if you are spending 1 hour, how many patients you can take care in a shift? That's a big question. So, you should be able to perform the task, but within the given time frame, then only you are skilled. If you are, same example, if you are driving from 10 kilometers in 2 hours, what is a skill? That is not a driving skill. You have to drive 10 kilometers in 15 minutes. That is what the skill is all about. So just like that. Demonstrate safe medication administration technique, including preparing and administering injection within a simulated clinical setting. Perform basic wound care techniques, including cleaning and dressing a wound within a simulated clinical setting. These are some of the example of objectives on psychomotor domain. So we have completed the Bloom's taxonomy, which is it's a part of developing objectives. Then move on to make it measurable and meaningful. That is the next step, third step. So how do you know if someone has achieved it? That's what I was talking about. Achieve it, or say measurable. So how do you know if someone is achieved it unless you are able to measure? So make it measurable. Then avoid, understand, learn, know words. Okay, even recall also acceptable. I have given that feedback to someone. Recall also very acceptable term, but avoid understand, learn, know kind of terms, so that it is not at all measurable. Student learn, student understand, student knows. How do you know that student knows? That's a big question. So never use these terms in your objectives as an action verb. Does the student need to do it in real life? This is a big question. Students will be able to do it in a simulator, but the students whether able to do it in a real life is a big question. So sometimes you have to make an objective. The students will be able to demonstrate. Students will be able to demonstrate intramuscular injection in a patient with so and so, a real patient in real clinical scenario. That is a task at next level. So you have to specify that. Whether the students do it in a real life is a big question. Will it enable them to do something else that they need to do in real life? See, here I tell you, I'm teaching therapeutic techniques to the students. My objective is to, at the end of the session, students will be able to demonstrate skills in therapy, communicating with the patient, therapeutic communication with the patient. Fine, that's my therapeutic. My objective is fulfilled. I have achieved the goal. The students have achieved the goal. But is there something extra? For example, by doing this therapeutic communication, what is the end product? The students will be able to develop IPR with the patient. So that will enable them to do something else, something extra than what you are actually taught. That's all. That's what end product is. So whenever you make an objective, that should be measurable one. Second is meaningful. That is the bottom two lines. You have to keep it in mind. So what are the elements of objective? One is performance or activity. You call it performance or activity. That is do what. Then a criteria, to what standard, and the condition. Under what condition? So I have given an example. The students will be able to demonstrate administration of medication via IM injection using a pre-filled syringe with 100% accuracy. Can I give you 30 seconds? Can you identify these components? Which one is performance? Which one is criteria? And which one is condition in the given, in the given example? 30 seconds. Anyone attempting? Yeah. Demonstrate is performance. Okay. Demonstrate administration of medication is a performance. Okay. Someone said it. Performance is demonstrate administration of medication together. Okay, right? Very good. Okay, performance is right. What is criteria? What is criteria? Criteria is 100% accuracy. Very good. Yes, with 100% accuracy is the criteria. Right, very good. Right, very good. Next, what is the condition? Rest you know. Condition is using a pre-filled syringe. There are syringe which you have to load. There are syringe which is already some insulin syringes and all comes in a pre-filled form. So using a pre-filled form, you need to know whether students are able to give intramuscular injection with a pre-filled syringe with 100% accuracy. That's what the expectation of a teacher on the student. And students are expected to do that. Okay, very good. Thank you for the participation to move on to. Okay, I'm just. Then qualities of educational objectives. So this all of you know, you may have learned this for research objectives as well as the educational objective. It should be always smart, specific, This all of this we have already learned. So just I want to put it together. It should be specific. It should be measurable. It should be attainable or achievable. You can whatever it is, attainable or achievable, because you cannot expect something which is not achievable by the student. Even time also, time based also, it should be realistic. Then relevant to the subject what you are teaching or the content you are teaching, or relevant to the course and objectives. Then time based, it should be time bound always. The common mistakes. So often when you are developing objective, the first point is debatable. I have told you in the beginning of the class. We will discuss about that point later. Move on to the second point, which is using objectives that are measurable. So using objectives that are not measurable should be avoided. Common mistakes using that. Mistaking activities for objectives. For example, when you are making an objective, at the end of the class, students discuss in groups to decide. These are activities. That is, see, you have our students able to develop a course plan. That is an objective. But if you state, at the end of the session, students will be able to participate in a group discussion to develop course plan, that is not right, because you are mistaking activities for objective. Objectives always try to go into the action verb: develop, produce, demonstrate, explain, describe, enlist, all those things. Okay, don't confuse the activities with the objective. That is one common mistake. Unrealistic expectation. So that's what it works in reverse. First you develop objective, then develop the content, then instructional strategy. If you don't do that, then it leads to unrealistic expectations. If the content is not matching with the objective, it will lead to unrealistic expectation. Now come to the first point. There are divided opinion, different school of thought, showing formal objectives to the audience in the beginning. One set of thought, or one school of thought says that it gives guidance, it gives focus, the students will be ready to learn what, and they know that what they're supposed to learn, all those things. The other thought of school of thought says that will reduces the creativity, and the students will be focusing only on pinpointed whatever the content is planned, and they know exactly what is the learning objective. They will only focus on that during the session or during the course. Beyond that, they will not think, they will not expand their thinking capacity and creativity. That is another school of thought. But to conclude,
thank you, Dr. Muthu, for your wonderful presentation, and it was really informative, and the students must have been really benefited by today's presentation. And you have explained about all that cognitive, psychomotor, affective in very detailed manner. And thank you so much. On behalf of College of Nursing, we extend our heartfelt thanks to you. And as we have come to the end of this program, I would like to propose the vote of thanks for today, because acknowledging everyone's involvement is important. So therefore, firstly, I would like to thank our Executive Director and CEO, Professor Dr. Meenu Singh, for the efforts she has put in motivating us for organizing this course. I must mention our deep sense of appreciation for Dean Academics, Professor Dr. J. Chaturvedi ma'am, for her constant support and her guidance. A leader is someone who creates an event. Team members eventually brings life in it. I would like to express my heartfelt thanks to Professor Dr. Smriti Arora, Principal, College of Nursing, who has been the driving force behind this academic activity, for her minute-to-minute guidance, support, and encouragement at every point of time in the organization of this course is remarkable. Thank you, ma'am. I would like to take this opportunity to place on record a heartfelt thanks to Dr. Rakhi Mishra, Assistant Professor, College of Nursing and Co-Organizing Secretary, for her enormous hard work, cooperation in organizing and coordinating the whole event. An academic activity of this dimension cannot happen overnight. It requires meticulous planning and execution and an eye for details. I would fail in my duty if I don't acknowledge Team ECHO for their valuable time, the training the technical support and encouragement at every point of time in the organization of this online course. Special thanks to Mr. Arun Kumar Selvaraj, DGM, Echo India, Mr. Gurdeep, and all other members of Echo India. Thank you, everyone. I would also like to appreciate the guest faculty, Dr. Poonam Joshi, Professor and Principal, College of Nursing, AIIMS Kalyani, Dr. Lata Venkateshan, Professor and Principal from AIIMS Delhi, Mrs. Cecilia Mary, Associate Professor from AIIMS Delhi, Dr. Ratish Nair, Officiating Principal from AIIMS Patna, Dr. Muthuvenkatachalam, Assistant Professor from IHBAS, for sharing their valuable knowledge with all our participants. Thank you, everyone. I would also like to acknowledge our esteemed faculty from College of Nursing, Dr. Rakesh Sharma, Dr. Rupinder Diol, Dr. Rakhi Mishra, and Dr. Rajesh Kumar for moderating the sessions. I extend my gratitude towards the help of our PG students, Ms. Devika and Preeta, for their involvement and the willingness towards the success of this program. At last, I express my sincere thanks to all the participants for showing enthusiasm in taking up this course and for their active involvement throughout all the sessions, which made this one-week program a huge success. Thank you, everyone. Jai Hind.
Thank you, everyone. May I please request all of you to please switch on your camera so that we can have one photograph?
Online photo session.
Yeah, online photo session. Save it.
We'll wait for everybody.
Still, I think many are left. Please put on your cameras. And hope we will meet you in person soon.
Splendid. Little smile, so cheese or something. Shall I take one more? Or? Same, same. Different people have it.
Okay, thank you so much, all of you.
Thank you, madam.
Goodbye.
Goodbye. Thank you. Have a happy weekend.